Hello, my name is Mohammed Mahdi, and today I will talk about the Nordic research, especially about the research problem. So, what is the research problem? A research problem is a question that researchers want to answer or a problem that researchers want to solve. Formulation of a research problem is the first step of the research process. Selection of research problem depends on several factors such as researchers' knowledge, skills, interests, experience, motivation, and creativity. With respect to the subject of any cure, most of the good research studies need lots of time for selection of a research problem. Definition of the research problem: research problem is sentences or statement that ask what relation exists between two or more variables. The answer to question will provide what is having sought in the research. Define problems as a situation for which we have no ready and successful response by previous accurate habit. We must find out what to do. Example, the situation the solution can be found out only after an investigation. In other words, a research problem is an area of concern where there is a gap in the knowledge base needed for professional practice. Sources of research problem: personal experience. Day to day personal experience of a research may serve as good source of ideas to formulate a research problem. For example, a researcher observed domestic violence suffered by wives of alcoholic husbands. This experience may provide idea to identify several research problems related to domestic violence against women. There may be so many such life experience of a researcher which could be used to develop a research problem. Practical experience. Nurses gets plenty of ideas to formulate research problems from their clinical experience. Every curious nurse has several questions to be answered which are encountered during clinical experience. For example, a nurse finds that unrestricted visiting hour in surgical wards reduce the analgesic demand among post-operative patients. Such clinical experience could be rich source of idea to identify a significant research problem. Critical appraisal of literature. When we critically study books and articles relating to the subject of our interest, including research reports, opinion articles, and summarizes of clinical issues, pertinent question may arise in our mind. This may strike readers' mind indirectly by stimulating imagination and direction directly by studying what addition research is needed. This information may serve as a basis for to formulate a research problem. Previous research findings. A body of knowledge should be developed on a sound foundation of research findings. Usually, at the end of research, further research problems are suggested based on the shortcoming of previous research which can be investigated. In nursing professional, not much research has been yet done. Therefore, this professional needs research who are willing to replicate or repeat other studies on different sampling and setting. Existing theory. Research is a process of theory developing and theory testing. Nurses use many theories from other disciplines in their practice. If an existing theory is used in developing a research problem, generally a part of parts of the theory are subjected to testing in the clinical situation. The testing of an existing theory is definitely needed in nursing, therefore they serve a good source of research problem. Social issues. Sometimes topics are suggested by more global, contemporary social or political issues of relevance to the healthcare community. For example, HIV, AIDS, sexual harassment, domestic violence, and general equality in healthcare and in research are some of the current social and political issues of concern for healthcare professionals. Brainstorming. Brainstorming sessions are good technique to find a new question where an intensive discussion among interested people of the profession is conducted to find more ideas to formulate a good research problem. For example, ideas for studies may emerge from reviewing research priorities by having brainstorming session with other nurse researchers or nurse facilitate. Institutions Traditionally, institutions are considered good source of knowledge as well as resource to find new research problems. It is believed that reflected mind is good source of idea which may be used to formulate a good research problem. Folklores. Common beliefs could be right or wrong. For example, it is generally believed that studying just before the test decreases the score. We believe we should not study just before test to relax our mind. Researchers can conduct a research study on whether one should study before the test or not. Exposure to field situations. During field exposure, researchers get variety of experience which may provide plenty of ideas to formulate research problem. For example, while working in field, a researcher observe a specific traditional practice for cure of disease condition which can be used as a research problem to investigate its efficacy. Thank you for listening and goodbye.